Now we will be discussing about the anatomical features of the scapula bone. Now, first of all, talking about its location. Scapula bone, it is actually large triangular bone which is actually present between the second and the seventh ribs at the posterior aspect of the chest wall. Talking about now its attachment, scapula bone is actually attached at the acromial extremity of the clavicle right here and at the humeral end where the head of the humerus actually articulates. Furthermore, talking about its further anatomical features, actually scapula bone possesses different borders, angles, and bony processes and its various aspects. So we will be discussing one by one. Talking about borders first. Actually, scapula bone consists of the three borders. This is the superior border, this is the medial border, and this is the lateral border. Now, coming on to the angles, we have also three angles of at the scapula. This is the superior angle, this is the inferior angle, and this is the lateral angle. And now talking about its bony processes, this is the acromion bony process, this is the coracoid process, and this is the spine process. So after discussing the bony processes, we will now come on the surfaces. There are two surfaces of the scapula bone. This is the anterior costal surface of the scapula, and this is the posterior dorsal surface of the scapula bone. Now discussing particularly the superior border. Superior border actually forms the upper edge of the scapula bone, and in the superior border a very important notch is present which is known as the scapular notch, and this scapular notch is present at the base of the coracoid process right here. And a very important ligament actually passes through this scapular notch which is known as the superior transverse scapular ligament. Also suprascapular artery which actually passes above the scapular notch, and we have the suprascapular nerve which actually passes below the scapular notch. Now continuing our discussion on the medial border. The medial border, it is actually present at the medial aspect close to the vertebral column. And now we will be discussing about that how angles are formed. Now first of all, talking about the superior angle, that how the superior angle is formed. Superior angle is formed when the superior border and the medial border articulates with each other, so superior angle formation takes place. And talking about the inferior angle, it is actually formed by that articulation of the lateral border with the medial border. And talking about the lateral angle, it is actually the lateral angle is formed by the articulation of the superior border and the lateral border. So that's actually concludes our lecture on the formation of the angles. Now continuing further, talking about specifically the lateral aspect of the scapula. The lateral aspect of the scapula, it is a very thick region and a very complex region of the scapula, as it possesses the head of the scapula and the neck of the scapula right here. At the base of the coracoid process, the neck of the scapula is present. Furthermore, very important anatomical aspects regions are present at the lateral end of the scapula. This is the glenoid fossa, which is a very important anatomical region present at the lateral end of the scapula, and this is actually you can say glenoid cavity where the head of the humerus articulates. And also we have a fibrocartilaginous structure known as the glenoid labrum. Glenoid labrum actually covers this whole glenoid cavity. So there are also two important regions that are present at the superior and inferior aspect of the glenoid fossa. First of all, talking about the inferior aspect, the anatomical region that is present below the glenoid fossa, it is known as the infraglenoid tubercle, where the long head of the tricep muscle actually articulates. And talking about the superior aspect, we have the supraglenoid tubercle present above the glenoid fossa or glenoid cavity. Now furthermore, talking about the after discussing the lateral aspect of the scapula, now we will be discussing the surfaces of the scapula. Now first of all, discussing the posterior surface of the scapula bone, which is also known as the dorsal aspect of the scapula bone. So our dorsal aspect of the scapula bone consists of the supraspinatus fossa and the infraspinatus fossa. and between them there is a bony process known as a spine, which actually runs from the medial border towards the acromion process at the lateral end. Now, this spine process actually differentiates the supraspinatus fossa and the infraspinatus fossa. And talking furthermore, at this region, at the base of the coracoid process, a very important notch is present, which is known as the greater scapular notch. Now, this greater scapular notch actually performs the function of the communication between the supraspinatus fossa and the infraspinatus fossa, and through this greater scapular notch, suprascapular vessels and nerve passes through and innervate this region. Now, furthermore, talking about the acromion process in detail, the acromion process actually forms our shoulder tip, and also it serves as the basis for the formation of the acromioclavicular joint as well. And we can also palpate this acromion process at the tip of our shoulder. Now, talking about the, you can say, costal surface of the scapula, which is the anterior aspect of the scapula bone. This costal surface actually consists of the, you can say, shallow concavity, which is mostly composed of the subscapular fossa. This is this region which I am highlighting. It is the subscapular fossa, which is present at the anterior surface of the scapula bone. At the superior end of the costal surface, if we look at the costal surface of the scapula, coracoid process is present. This is the coracoid process which is present at the costal surface of the scapula, and we can palpate this coracoid process. And also, first of all, telling about the location of the coracoid process, this is present between the head and neck region. So between the head of the scapula and the neck of the scapula, coracoid process is present right at the junction of neck and head of the scapula, and we can palpate the coracoid process. We can easily palpate the coracoid process if we actually exert the pressure on our deltoid muscle. So coracoid process is palpated. So this concludes our basic lecture on all the anatomical features of the scapula, and hope you guys have understood it well. And last but not the least, don't forget subscribing MS Lectures. Thank you.